Women's History Month really represents a time to celebrate our achievements and look forward to the future of all the great things we can do.
They have pushed past boundaries, they've set new norms and created new standards.
When we think about diversity, we very much think about the contributions of women.
A lot of this work has been done by women, and they have not been recognized.
It gives us all an opportunity to stop and reflect on that and to see what more we can do.
Early on in my career, one of my greatest challenges was being underestimated as a young female. And that gave me the opportunity to really show patients and family members during my encounters with them that I was confident in my care.
One of the challenges that I have faced as a woman in my role is really overcoming the bias that men are chairs. And so there is this expectation to see a man when you hear the name Dr. Neal-Perry. So that's one challenge.
There were so many instances in my own career where people wouldn't even consider working with me because I was a woman. Just having a seat at the table and being able to be listened to, that to me feels different than it did 10 years ago.
I think one way that I'm breaking the bias is by serving as a champion or a mentor or supporter of other females, particularly women of color, by changing the complexion of the industry or the organization in terms of creating some diversity, having more females serve in leadership capacities.
Really building out self-care practices into your daily schedule and really protecting that time for those things. Whether it's a walk in the morning, whether it's, oh, I close my laptop at this time. You know, finding out what's really for you and helps you to reset and, work on your mental health.
It's really important while we're at work, being present with our coworkers and taking the time to go past just how are you doing and really taking and being present in the moment, making that eye contact, saying, hey, how are you doing? How are you really doing? You know, are you doing okay? And my favorite thing to ask is, what can I do to make your day better?
Why not? I mean, we have to celebrate everything that we do, and particularly because women have to wear so many hats. We do what we do at work, we do what we do at home, and something in between. And we don't really have the luxury of having that time to change and turn on one role and turn the other one off.
I think it's important for all the women in science and medicine who did the work, and their work was attributed to other people. I think it's important to talk about women's contribution.
The ability to lead because I stand on shoulders of women who've made many sacrifices for me to be here today.
It's a time to promote present and future generations of women to continue that forward momentum.
It's important to give attribution to people who have had great ideas and done great work.
It serves as a reminder. It makes us pause at a moment in time in the month of March to look at this and really reflect on all of the accomplishments.
It's also a time for me to sit down and look at myself and really see what I want to contribute to history and to the world.